What's up, everybody? It's so good to be back. Yes, how have you guys been doing? Today's episode is going to be kind of interesting because, we kind of heard of this term before, but we hardly speak about it, and I'm pretty sure a lot of people are going through it as well. We got two special ladies on the show today. That's why I'm very, very excited. I can't stop talking. Welcome back to Mamak Sessions. Hello. How is everybody doing? You see, before I can even start the show, I start messing up already because I have two very gorgeous ladies on the show today. Hello, we have Dr. Sherini and also Nirosha on the show. Welcome to Mamak Sessions, ladies.
Hi, thanks for having us.
Yeah, how have you been? How are you guys still currently working from home? Okay, doctor, I know it's a stupid question. Obviously, you don't work from home, but how have you guys been?
Who should start? Oh, I'll start first then.
Yes.
Yeah, sure.
I have been the same. I guess nothing exciting. Hoping that the cases of COVID is coming down. I hope then we'll be a bit less busy than what we used to be.
Yeah, I mean, I've spoken to some doctors who were actually of a certain specialist, right? Then they said that they have to basically put their specialist, how do you call it? That means that they have to put what they normally do on a daily basis aside and basically report to the hospitals because they have to basically serve as frontliners. And I was talking to him in my previous two episodes, and I really applaud what you guys go through, and despite the current situation, and you guys are literally in the front line. Although everybody keeps saying that we are all frontliners because it's all our responsibility to make sure that everybody is safe, right? But for you guys to be out there, I applaud you. Thank you.
Thank you.
Yes.
To all of the frontliners. I think, I work in private sector, so we are not as busy as the government side, but I think the real true heroes must be in the government side, I personally think.
Mm-hmm, mm-hmm. And yes, and today also on the show, we have Nirosha. Hello, Nirosha. Welcome to the show.
Hi, Jeannie. How are you?
I'm very good, thank you. And, just for the benefit of our listeners, I know we know, Dr. Sherini is a doctor. Could you care to tell our listeners, about yourself, where you're from, what do you do?
Sure. Well, okay, for everyone, I'm Nirosha Krishams. I am actually in my early 30s. I'm married and I have a daughter that's 2 years right now. And I'm a full-time working mother. So today I'm going to be sharing a little bit about my personal experience in battling with migraine.
Yeah,
right?
exactly.
So a little bit about, great. So a little bit about me would be, my background is that I am actually a director for a local consultancy and a marketing company for several years. And working in this industry, it often requires me to work long hours with a hectic work schedule, which have largely contributed to my migraine issues. And today, I'm going to be sharing my personal journey in regards to that.
Exactly. I mean, she really did the introduction before I could introduce it. Yeah, the reason for this whole entire conversation today is because, look, we were supposed to record this conversation a while back because of the current situation, we keep on delay. And I knew I wanted to talk about this because it's something very common that sometimes people always use very loosely, in my honest opinion. People, the minute they say that, oh yeah, I'm working long hours, migraine lah, and stuff like that, and I go pop a paracetamol and stuff like that. So the thing is, I have had a friend when I was in primary school. Yeah, I had one day I remember. I vividly I remember. I went to class. There was this girl who came in maybe halfway through the semester. She came in for 2 days, and after that, she never came into the semester at all. We didn't see her anymore. And then we were wondering, okay, yeah, we understand. She's a new student. She came in. She looked perfectly normal. And when she didn't show up for 1 day, 2 days, then 1 week, then 2 weeks, and then after when we asked the teacher, what happened to the student teacher? And then, they had the migraine. And we were okay, why? The thing is, a lot of people, for me, when I was younger, I always think that migraine is just a headache, right? Until we got to know her, she told us about her situation, that migraine can actually get pretty serious, and she had to be homebound for a really long time. I mean, would you care to elaborate about this, doctor?
Yeah, so I think migraine is sort of synonymously used with headaches, so interchangeably. used, like you've mentioned. But there is a difference between headaches and migraine. And I think a lot of time, not just your story, I think anyone's working, if you have your colleagues who doesn't come to work, and when they say they have migraine, the stigma that attached to it is like, what? Only headache and you don't come to work.
Yeah.
But don't you think so? And then but actually migraine can be very severe. And by the time some of my patients come to see me in a specialist clinic, they don't have simple migraine. They probably have daily migraines, or what we call chronic migraine. They may have 3 or 4 times of migraine attacks a week. And the actual headache itself can be very severe, to a point that they have to stop what they're doing, and they get very disabled with the headaches.
Yeah. The thing is, a lot of people tend to always correlate migraine, right, with having a headache on one side of your head. It's like, my left side of my head. I can't remember what's left or right. Okay, sorry. My left side of my head is pain. I was like, migraine. Straight away, everybody or your expert friends say, ni ada migraine ni. And stuff like that. Is it true? Is migraine basically having a headache in just one side of your head, or is it more complex than just that?
Yeah, so there are different types of headaches. Migraine is the commonest type of headache, so it's only one part of headaches. There are different types of headaches, like tension headache, trigeminal headaches. So what people always say as well is, I have normal headache. This is not migraine headache. What is normal headaches? So people associate normal headaches like, last night I did not sleep very well. I drank too much coffee, or maybe I was just too stressed out. So those are they call it as mild headaches.
Right.
But migraine has a very specific characteristic to it. And this is what we look out for when patients come to clinic. We talk a lot to them, and we ask them a lot of questions. So the characteristic is different. Headache itself can be one side. Generally, it's one side that you said correctly. But it can happen on different side. It can happen both sides, on the front part of the head. It has this characteristic of like pounding, throbbing, squeezing type of headaches. And it can last for a few hours. Can go on for days. People get surprised. How come my headache never go away? And it lasted for like few days. Yes, that can happen. And when you have the headaches, you probably feel a bit nauseated. You may vomit, and sometimes vomiting makes you feel better. And you may have a sensitivity to light. So certain things irritates you, like bright lights, noises, too loud of a noise. Certain smell irritates you, and all you want to do is just go to sleep. And some people actually experience quite scary experience, I would say, because before they get their headaches, they get this thing like we call aura or warning. So they may see certain things like flickering lights or flashing lights, or wavy lines or zigzaggy lines, which can be black and white or colorful. And if that happens to you, or that happens to me for the first time, I'll be like so scared. Am I getting a stroke or something,
Oh, wow. Okay.
So time they will go to an ophthalmologist and say, is there something wrong with my eyes? Why am I seeing these colorful things? But these are called aura. And not all people have aura before their migraine, but some people do.
Yeah. Okay. Look, with regards to migraine, right? Is it always stress related? Because, so just now I mentioned about how I had this classmate that came in, and she's so young. And come on, like, kids, where got stress, right? I mean, like, got lah. I don't want to discount the fact that, yes, some of us do study really, really hard until we get stressed. But is migraine generally only triggered by stress, or is it hereditary? Did I pronounce it right? Hereditary. Yeah.
I think what I always tell my patients is that, when they come into clinic, why me? How come I get it and my sister doesn't get it?
Right.
So where is that hereditary thing coming from? So a lot of time we don't know who gets migraine, but we do feel there is a genetic factors, because a lot of time if we really look hard, there is a family history.
Yes.
But not everyone or not all your siblings will have migraine. Maybe 1 or 2 of you will have migraines. But what are the triggers? So these triggers, if you put it on people who do not have the tendency to have migraine, it may do nothing to them. Right. So you can stay out and play video games, whatever, like you said, and you never get headaches. But people with migraine, these triggers can actually cause them to have migraine. So stress is only one of the triggers. lack of sleep, a certain type of food, caffeine. Some people cannot take coffee or chocolate or cheese or dairy products because that can trigger their headaches. Also, if they are under a lot of stress, like you said, bright lights. And these days I'm hearing, we're all doing meetings on Zoom these days. So a lot of screen time, and too much screen time also can trigger headaches.
Okay.
Yeah, so you're staring at screen all the time. Your eyes are like really tired, and that can trigger headaches. If the air is too stuffy, if the weather is too hot, some people can't stay in the air-conditioned room because they can get migraines. So there are many actually triggers for migraine.
Yeah, and so, okay, when you say triggers, right, these are people with hereditary, there's a chance of, basically having one of their family members already that has migraine, or these are people who are completely with no migraine at all, no symptoms, no nothing, haven't gone through migraine before, and all of a sudden gets a migraine.
So that's called sporadic, meaning you can't get a family history. So I do have patients where you ask very hard and they say, no, my mom got no migraine, my great-grandparents got no migraine, So there are people where we cannot find a family history and it just happens. So these are the ones that we don't know what actually caused them to have migraines.
Right. Wow. When you mentioned, play video games also can trigger migraine, I'd be like, what? Oh my gosh. Are they just having fun? You can get migraines? That's horrible.
Yes, not enough sleep as well.
Okay, forgive me if I ask this and if it sounds stupid, but can migraine lead to anything fatal or not?
Actually, migraine is very benign, but the problem is when we say, so when I say benign, that means it's not something serious.
Got it. Okay.
But when we say it's not something serious, this is when the stigma comes from, because when we say it's not something serious, people will start taking it lightly, like, it's just migraine. But it is not serious, meaning it's not like cancer, it doesn't kill you, but it can be debilitating. Do you know that migraine sometimes can have symptoms of which mimics like a stroke? So people with migraine, if it's so severe, they may not be able to concentrate. Some of them cannot even get their words out. Some of them may have like numbness on one side or weakness on one side. Some people have ringing in the ear. They have very severe dizziness with the headache. The room is spinning around them. How do you expect people with migraine to actually go to work if they get severe headaches like this?
Yes. So, okay, when you mention people who have migraine, they will see the whole room spinning around. Is that called aneurysm?
That's called vertigo.
Oh, sorry, vertigo. Vertigo. Yes, vertigo. So I'm not sure why I said it. Yeah, vertigo. Yes, because my classmate kept telling us, or when we asked what's wrong, she said that she feels like she's always in a tornado. And being kids, we're like, whoa, okay, we don't understand. And then for the general term, they just... Funnily enough, that's how I got to know what migraine was. I'd be like, migraine, okay, head spinning around, that kind of thing. And then as we grow up, it just basically leads up. It's just so commonly used, so loosely used as, I call migraine now because I'm working too hard. And we have, obviously we have someone who's gone through or who had migraine, Nirosha. I mean, thanks for being a part of this conversation today. To be honest, I am not on one to say how bad your migraine was, but would you care to share, what did you go through? Is it right for me to say that she is or was a migraine patient?
I think I was a migraine patient because I'm actually feeling so much better after seeking or consulting a neurologist, which is my doctor, Dr. Sherini. So yes, I don't mind. I'm definitely happy and delighted to share my personal journey in battling with migraine. So like you said, I was one of the persons that always thought migraine, it is just another fancy word for headache. That's what a lot of people, usually address that as, right? So when I had this, this constant headaches and all that, I was not able to understand. I was just thinking maybe I'm having just broken sleeps or maybe a lot of stress at work and long working hours. So until at a certain point, right, it started disrupting my daily activities, my life as a whole.
Right.
So there's one time, a lot of people often think migraine is just it's very much downplayed. if I can say that right. It's very much downplayed, like you just said. So when I, told myself like, okay, migraine. So what exactly is a migraine? So obviously being a normal person, because I'm not a neurologist, so I'm not able to understand that.
Yep.
So one time it was very severe to a point that I wake up with a headache. I go to sleep with a headache. I eat with a headache. It was literally, my world was filled with headaches.
Oh, wow.
And I was still thinking, it'll be fine with painkillers. So I was popping painkillers every 2 hours. And I think I've shared that with Dr. Sharini as well. So it was just constantly happening for over 2 months.
Right.
To a certain point, it started making my other parts of my body to be a little ill. For instance, like I was getting severe gastritis attacks.
Oh.
And then emotional turbulences. I was just gaining so much weight, and hair. I was losing hair. All of this, but people do not understand. They just think it's just a headache. So when this thing happened, I've started to, be a little, I would say, down, I guess, depressed, I guess, because I didn't know what was the solution to it besides just taking regular painkillers. So that is the time I met my family doctor. I must mention about him is Dr. Mohan Raj, who happens to be my gastroenterologist.
Right.
So I went to him and I was just discussing about this normal gastritis issues, right?
Yeah.
And then he started asking me about my headaches then, because I did mention about like I'm waking up with a headache, broken sleep and all that. And then he told me that, you know what, Nirosha? I think you should consult a neurologist.
Right.
And I was seriously stunned, shocked, and scared. I mean, neurologist for a headache? Come on. I don't need a brain doctor to fix my headache right now. That was my feedback to him. I was a little hesitant. I was a little scared. So I took a little bit time off, whether if I should really see or consult a neurologist. But again, through I guess, inter-referrals. And he referred me to Dr. Sharini at SGMC.
Right.
Of course, I was a little still hesitant. I still did not want to see Dr. Sharini because I was still in denial. This is just a normal headache, right?
Mm-hmm.
So
and may I ask, like, were your family members also like say, nah, man, headache only what? Just take painkiller can already lah. You know, that kind of thing. Were you getting that as well?
Oh, they were telling me that like you're just seriously wasting your time and you're wasting your money. That was their feedback.
Ooh.
Not just family members, but workmates. Everywhere. When I tell that I see a neurologist for migraine, they were like, okay, but who sees a neurologist for a migraine?
It kind of gives me the same sentiment, like, like someone is having a mental breakdown and they go see a psychiatrist. Yo, why you go see a psychiatrist? You crazy, that kind of thing. They tend
exactly,
to, there's like a stigma. There's a stigma with all these things. But yeah, I know, I get where you're coming from when you say, oh, I'm going to see a brain doctor. A minute in your mind, you're like, oh, do I need to have brain surgery? A lot, very shallow. Look, I don't mean to be shallow, but some people will think that, the minute you go and see a brain doctor, it means something is wrong with your head. That kind of thing.
Yeah. May I just add something on top of that? I think because I was one of the person that just completely thought the same way like you did.
Mm-hmm.
I guess it's the awareness around migraine as a whole, how much is downplayed in our society today, right?
Yeah.
But if you were to look at migraine in different parts of the world, people take it seriously. I have had colleagues working in overseas and where they actually call in sick for migraine.
Mm-hmm.
And I didn't understand why would they do that until me as a person today, I guess a year ago, had to go through the entire migraine process.
Right.
Yep.
Okay. What was the worst case scenario when you were actually going through migraine? What was the worst thing that ever happened? Like, did you throw up? Did you have like vertigo and stuff like that? How did it affect your life actually?
Okay, that's a very good question. But I think, again, this is very subjective.
Yeah.
I guess it works differently on different individuals.
Mm-hmm.
And that's why you need to let your doctor to understand your lifestyle, just like how accurately Dr. Sharini has shared. For me personally, I had broken sleep cycles, number one. I would be like, moving a lot in bed while sleeping. So I would literally have 2 hours of sleep every night.
Oh, wow.
So that's like 2 to 3 hours maximum because you just... the throbbing pain is just in the back of your temple, your head. And then the pain just like literally goes down to your neck and to your shoulder. And you just become like completely numb the next morning. Now, fortunately, I did not have the throwing up sensation. Of course, thank God. But I did have like you have I don't know, like maybe hundreds of kgs of stones inside, like put on your head. And you're just walking around. That's the feeling I went through. And you pretty much because see the pain was so severe
Yeah.
that I was constantly looking for avenues to get rid of my pain. So I would like just go and eat a lot to forget the pain. I would be doing something just to forget the pain. So this was kind of quite scary actually, because my life is completely changed because of this migraine.
Yeah. Dr. Srini, does this also, okay, if a person doesn't really consult a doctor, right, or a specialist with regards to their migraine problem, would it also eventually lead to psychological side effects, like based on what I'm hearing from Nirosha is like, it kind of, it in a way affected her mentally as well.
Yeah, I mean, just to mention about like the stigma of coming to see neurologists. I mean, I don't blame you saying that neurologists cut brains, because until now my father think that my job involved cutting brain, which I don't.
Oh, okay.
My dad. Anyway, but you have to know that migraine is one of the leading cause of years of disability among people, and what we say about disability, like what Nirosha said, that in other countries, for example, in the States, migraine is actually is covered under the Disability Act.
Oh, really?
Yeah, they are actually protected. Patients' migraine are protected. If you actually keep taking times off because of your migraine, your employer can't take action upon you. It's wrong for them to do that because they're protected by the Disability Act. That's how debilitating and how migraine can cause disability. And there's a relationship between people with migraine and depression. A lot of time when they start saying that they have migraine, people keep downplaying and say it's just migraine, you really cannot withstand pain, like you're so manja, that's a word you use, right? Manja. And because of that, they keep everything inside. They bear with the pain. They can't concentrate. They can't perform at work. They get scolded by their bosses. And because of this, it creates a lot of anxiety and depression. And they can't do what they want to do. They can't eat what they want to eat. They have to miss a lot of exciting things that their friends are doing because of migraine. And these days, it's very important because migraine doesn't just involve people like our age, like, well, maybe I'm so much older than you, but
no, you look young, come on. I'm kidding, I'm sorry. Yes.
But anyway, but I'm seeing migraine in children and adolescents. So I'm not a pediatric neurologist, but I sometimes do see patients in the range of like 16 years old, and they've already started to live with migraine. But what can you do? They can't miss their classes. They still have to go to the class, and because of that, they can't concentrate. And then they come back, they have to do homework. They've got tuition, they've got coursework. They can't get out from this cage, like what Nirosha is saying. They can't get out from this cage. They need to get something to clear the pain, but they can't. Can you imagine living with pain like what Nirosha has just mentioned? It's horrible.
Yeah, and okay, so I want to rewind back to when you were mentioning how migraine can be triggered when you're staring at the screen for too long. I'm asking this because, I'm a parent. Yeah. I'm a parent, right? With the use of technology these days and mobile phones and computer screens being more of a norm thing amongst youngsters and all of us, this may sound again like a stupid question, but does technological advancements with mobile phones contribute to rising cases of migraine?
I think there is definitely a contributory factor there.
Okay.
But we can't, like I said, this is part of the norm now. We can't do much about it. If we stop them from staring at the computers or joining the Zoom class, they're going to miss out on a lot of things. So what I normally suggest to my patients is that take regular breaks, when you actually look at the tablets, make sure that the screen brightness is actually reduced. These days they're selling all sort of like glasses for the children.
I think a lot of brands are actually taking one step forward to kind of address this? Like, okay, like for example, the color temperature of your screen, instead of having it too blue, now you can have like a sort of like a function where it turns it to be a little bit more warmer, so that's a little bit more pleasing to the eyes and stuff like that. So I think there are some advancements and responsibility with regards to all brands, these days, because, a lot of technological brands that we use, mobile phones and whatever not these days, they all have a section that's dedicated to health. You know what I mean? So maybe they realize something, but
That's what they call it, right?
yeah. But okay, Nirosha, how long did you from the time you realized you had a headache until the time you finally found out that it was migraine? How long was that?
That was like I mentioned to you earlier, it was like 2 months. I was like just having this attacks of headaches, right? It was severe. So I was having a lot of painkillers just to try to medicate myself, I guess, like a doctor.
Yeah.
So I think it was about 2 months after I've consulted Dr. Sharini sometime last year, when MCO kickstarted last year, the lockdown.
Okay.
So of course we were all homebounded and we had to work from home and everything, the sleep pattern, working hours, everything has changed at that point. So that is the time I've decided to, of course, consult Dr. Sharini, a neurologist. So it took me about a good 2 months to even realize that.
Oh, wow. So it was 2 months of nonstop pain every day.
Yeah.
Oh, wow.
But lots and lots of painkillers.
Okay, but before that, before you started having headaches, you never had headaches before, right?
Well, I did, but it was more of okay, if I were to have a coffee, I'm good.
Okay.
It was just it was just like a normal thing. It wasn't as bad as this.
Okay.
So that's when I was getting a little, I guess it was just an accumulated sort of like a factor, I think.
Okay.
So to an extent that it pretty much made it even more worse last year around January, February.
Oh, wow.
So before that, I used to have it, but not so severe.
Okay,
you know
but you basically shrugged it off as like a headache lah. It's like, oh no, it's just a headache.
It was just fine. It's just like a normal thing. We'll just get back to work. That was the thing, yeah.
Which brings me to my next question, Dr. Srini. So if you have a headache, right, and you always shrug it off as a headache, but in actual fact, you are kind of like maybe having migraine. So would early treatment kind of negate the fact that, it'll get worse? Or, if you basically don't treat it at all, it will get so bad until it'll take a longer time for recovery?
That's a very good question, because, we always treat what we call episodic migraine. What Nirosha was having much earlier on is what we call episodic migraine. So it comes in episodes, in clusters. So maybe you probably have 1 or twice of headaches a month. And a lot of people are worried about painkillers, taking painkillers, which I keep telling them is okay, because if you're only taking painkillers 1 or twice a month, and that would mean that you can actually function and continue what you're doing, it's okay to do that. But if you start having more attacks, like maybe once or twice a week, then you're realizing that you're taking more painkillers. Like in Nirosha's case, she's starting to have what we call chronic headaches. In which she's having headaches more than 15 days in a month. And this is when complications happen. She starts having gastric problem because of the painkillers she's taking. We don't know who will actually transform from episodic migraine into chronic migraine. We actually don't know, but there's a small number of patients where they started off with very infrequent headaches, but it matches the characteristic of migraine, but it's short-lasting and still well-controlled, but eventually become chronic migraine. So I don't know who will get it, but it is important, awareness program like something like this, to tell people that migraine can become frequent, can drag on to few days to 1 week to every day to 1 month or few months,
And how does this affect pregnant women? I'm very curious.
Okay.
Could it trigger I'm going to ask a lot of questions because could this be a problem for women who are trying to conceive children, or women who already have children or are currently pregnant with a kid?
So when we talk about migraine and women and migraine is another whole topic, okay, because we know that women are more common to get migraine than men. Somehow.
Really? Why?
We think because of the hormones, blame the hormones. What else to blame?
Okay. I thought you were gonna say it's because it's the men. Okay. So yeah. Okay. Yeah.
So women are 3 times more common to get migraine than men. And we say this. We know this is because of estrogen in the body, so the hormonal levels and fluctuations. And so there's this term that we call menstrual migraine. And every time when I tell my patients this, they're quite surprised. Oh, really? I don't know about that. So just a few days before their menses, during the menses, and a few days after, they may get headaches. And they only get around this time of the month. So this is what we call menstrual migraine.
Got it. Okay.
Now, there are slightly lucky women out there when they are pregnant, their migraine goes away.
Oh, okay.
Yeah. So, but not everyone with, not every woman with migraines will have their migraine go away during pregnancy, but especially those who have menstrual migraine, because of the level of estrogen in the body during pregnancy, so their migraine goes away.
Right.
But the thing is, that's just your honeymoon period. Once the baby come out, and then the lack of sleep, the feeding time, the changing time, everything else, you're screaming, and that will then trigger the migraine again.
Oh, wow.
So, but when it comes to pregnancy and migraine, there are some issues that needs to be touched about, which is the medication. So when we give patients medications for migraine, we actually advise them not to take this medication if they're planning to be pregnant, because when we treat migraine, there are different types of treatment. Okay, so if you do not get very frequent headaches, so like I mentioned earlier, simple painkillers should work. But if you start taking more regular painkillers, so we have to move on to a slightly different treatment, which we call prevention treatment.
Right.
And these are medications that you take on a daily basis, regardless whether that day you have a headaches or not. And you usually try it on for about 3 to 6 months. And whether you want to continue taking that depends on your assessment by the neurologist. But if you are planning to be pregnant, or if you're pregnant, a lot of these prevention medicines are not recommended to be taken due to the side effects on the baby.
Understand. No, I mean, like, we've been talking about this for almost like 30 minutes now. Is there a cure for migraine?
Well, that's another good question. Is there a cure for migraine? So I mentioned to you about the relationship between hormone and women and migraine.
Yeah.
So
I mean, we don't want to discount men too. Men get migraine too, because you see, right? Again, like when Nirosha was talking to both Nirosha and you, we tend to always use it as sort of like an excuse. It's such a common term, migraine, and people just don't see the severity in it. So like, is it because there is a cure for migraine? People are like, migraine, no problem lah. People always assume that migraine, there's a cure for it. Maybe not everyone, but some people do. Again, when they correlate it together with a headache, they just think painkiller, cure, gao dim. So is there a cure for migraine?
Okay, so there is no cure for migraine, but we do have medications that can control the migraine. But why I mentioned about the menstrual migraine is that some people, or some women, the good thing is some women, after they reach menopause, the migraine may just go away. So I take that as cure for migraine, menopause as a cure for migraine. But it doesn't happen to everyone. So I still have a small cohort of patients who are above 50, above 60 years old, who still come to my clinic with migraine. But these are small numbers. Somehow, after they get older, the frequency and the attacks of migraine actually subsided and get less frequent, or maybe go away. Yeah.
Right. And how are treatments for migraine like? Is it just purely oral, or how does it differ from like back then and now?
Okay, so I like to group my treatment for migraines into the ones that we give when someone's having the headache, which is what we call acute treatment. And then prevention, like I've mentioned before, and then lifestyle changes. So you cannot look migraine as what is the medicine? Just give me now, and take it away. It's not a short-term solution. When we treat migraine, we have to look at it as a whole. We spend a lot of time talking about triggers today. So when we talk about acute treatment, there's always oral treatment that can be taken. Can be bought over the counters, but if it's so severe in hospital, we do give intravenous therapy or some sort of painkillers to help abort the pain.
What is intravenous therapy?
It's the little tube that you put inside your vein, and then so you can put the drip into
got it.
when you're
Okay.
in the hospital.
Okay.
So this one we put the drug through that tube.
Okay.
Okay. So with prevention treatment now, in the older days we have only oral treatment.
Right.
These days we have the injectable ones as well. So the injectables ones are not given every day. So that is slightly more convenient to patient, but the oral treatment is something that you take every day. And all of them come with their own pros and cons, and the neurologist will then decide which one will fit the patient's best. Like I said, if the patient have problems sleeping and that's the trigger for the migraine, they may choose the drugs that actually will treat the migraine and also help with the sleeping. So it's tailored to what sort of patient you are seeing, what are the triggers. And then we talk about lifestyle changes. So don't forget about that. So you have to identify your triggers. I normally have my patients coming with a headache diary. And then from that moment, when they look at the diary, I will ask them, why do you think you have headache that day? What happened that day? What did you eat? How was your sleep? Were you having your menses at that time? So identifying your triggers and trying to avoid the triggers if possible.
Okay, so is this the latest way to treat migraine, or are there any other innovative ways that there are like more stuff that that people can basically consult to have their migraines treated?
There are more ways these days. I mean, people are trying different ways. There's also devices that have been used to treat migraine. For example, I've mentioned to you, like if someone is pregnant, you are a bit stuck because you can't give them drugs, right?
Right.
So we don't have some of these devices, and some of them we have. So there are sort of like devices that help to stimulate the nerves to treat migraine patient acutely and also chronically. And there is also other ways that, like relaxation techniques that can be used. There is also injections to the nerve that can be used as well.
Oh, wow. Okay. So Nirosha, could you kind of share about the treatments that you actually received from Dr. Srini, and how has it helped you so far? And currently, like today, like present day today, are you still going through treatment, or you don't need it anymore, or do you take something when you need it? What are you going through today?
Okay, so I consulted Dr. Sherry sometime last year, March.
Yep.
And I've actually been on a treatment plan that was like just like what Dr. Sherry has mentioned, right? It was kind of like tailored for me. So depending on my lifestyle and all. So she did mix a little bit of a combination of treatment plans for me.
Mm-hmm.
So that was like some orals and some injectables. So I've been on it for about a year, and I've successfully completed it. And I'm like, I remember you asked a question, is there a cure for migraine? Well, I do not know, but I completely forgotten what migraine was like.
Right.
That's the current situation.
Oh, that's good. That's good. That's good.
Thanks to Dr. Sharini.
Yeah.
I guess the first step is to consult your neurologist first in order to address whatever that you're facing with your migraines.
Right. Yeah, because it's not just a headache, right?
Yes.
Yeah.
Not just a headache.
Right.
Yeah, because my wife always tells me that she has migraine, and for me it's like, again, you just don't. It doesn't trigger you to just drive her to the hospital. And also, I'm not sure whether it's just like a common term being used by everyone. Sometimes people tend to use the term migraine very loosely. It's like headache, or I have a migraine. Does migraine cause blackouts? As I asked that question, the thunder was striking behind me. I'm like, wow. Yeah. So, yeah, does migraine cause blackouts?
Well, technically, migraine shouldn't cause blackout.
Okay.
But you know how different people have different level of pain threshold, right?
Right.
So if the migraine is so severe, like any pain, not just the head pain, okay? If you hurt yourself and you have a severe pain in your knee or tummy or whatever,
yep,
and that can actually cause you to have a transient blackout.
Oh.
So if the headache is so severe, then it can cause someone to black out if they cannot tolerate the pain.
Okay. So for the benefit of the listeners who are listening in right now, when should they start consulting a neurologist? Okay, because they can say that, okay, I have headache one day, tomorrow still got, third day got. Don't worry, I can ride this headache out for the next 7 days. And then 7 days still got, then they're like, don't want. So when is that like tipping point where like, you know what? I think something's not right with me. I need to go and see a neurologist.
I think when the headaches becomes more frequent, so like if you have the headaches once or twice a month, like I said, a simple painkiller may do. A lot of times they can actually go and see their the most convenient way is actually to see the clinic doctors, or any general practice. But if the headaches become more frequent and the painkiller doesn't help anymore, then they shouldn't wait any longer and come and see neurologists. Well, we all assume all headaches are migraine. A lot of time you need to be assessed by neurologists. Don't be scared to come and see us. We're very friendly people and we do talk to you a lot. So and
why do you think
very long?
why do you think people are afraid to go see a neurologist?
I don't know, Nirosha. Why do you think?
I was just scared that you were gonna cut my brains like your dad said.
Okay.
There you go. Are you afraid to see a neurologist? What do you think, Julie? Are you afraid to see a neurologist?
I don't know though, because neurologist, right? I always think that neurologist it has to do with nerves, right? Am I right or am I wrong?
Yes, you're right. Well, so, you got that part right, yes.
I think, so I knew about neurologists because my mom had a slip disc, you see. So a slip disc kind of affects the nerves, and then so neurology is not just about the brain. Like a brain, she had a slip disc, and it basically made her hand numb. So she had to go and see a neurologist because she needed medication to basically kind of treat her nerves and stuff like that. That's how I got to know about neurologists. Yeah. But for me, that's my assumption of neurologists: nerves connecting every parts of sending signals to all parts of your body. You know what I mean? And everything comes from the brain. So for me, as long as I have this may again sound shallow. Like, if I didn't get into an accident or have a blood clot, I don't have to go see a neurologist. That's my assumption of whether I should go and see a neurologist or not. But I mean, it's good to have this conversation. At least people, it's like people can go and see a neurologist as a form of consultancy as well, to understand what is really wrong with you. Even though when you don't have any, when you're not suffering from pain that is impact inflicted. Because that's the thing. That's what I think. That's when I think I should go and see a neurologist. When I hit my head, I impacted. Then I have to go see a neurologist. They have to assess me and stuff like that. And the other part I hear about neurologists is when Elon Musk basically announced that he's gonna implant a chip in people's head. It's called the neuron. Don't know whatever. Not okay. That's about it. That's too much, already, huh? That's that's a whole thing altogether.
That's a bit too much already.
Yeah.
But, you are right, because a lot of people are afraid. They actually, some of them don't know who to see. So this is what you're doing. You're telling people that if you have headaches, you go and see a neurologist, because a lot of time they don't know, do I come and see you, doctor? Do I see an ophthalmologist? Because is it my eye? Because a lot of time they get a pain behind their eye. So they think it's the problem with the eye. So they don't come to us directly. And the other thing is, I find that when they come to us, actually, they're worried about something else. They're not worried about migraine. They come to us because they think, doctor, I have this headache that lasted for about a week. I think it's a tumor. I think I'm having a stroke, or maybe I'm going to have a stroke. They
don't want the answer. They always are afraid of the truth. If I go to the dentist, right, just to basically clean my teeth, but I'm just afraid he'll say, sorry, I have to take it out.
Exactly. Exactly. That's right. You are absolutely right. I think it's the fear of finding out something more serious than, like you said, something more serious than migraine. Yeah,
just like how people are so afraid to go and get a doctor's checkup because they're just afraid to find out that something is wrong with them. Oh my gosh.
I always say that when you're in your 20s, do whatever, check my blood, whatever, I'm not afraid. But once you reach over 40, and you start thinking, should I go and check my blood? Is my cholesterol high? The doctor's going to say I've got diabetes.
Yeah, yeah, exactly. Okay, that's good. I really appreciate this conversation. I mean, I personally have learned something from it, and I hope people listening right now can take away something from this and not just shrug it off when you're having a headache. And again, I just want to ask you a question. Migraine pain, okay? The pain of migraine. What type of pain can you have? Because you just mentioned a pain behind the eyeball. So I've had that before, and I don't have it now. So for me, it's maybe I don't have a migraine. Maybe that was just at one period of time. What kind of pain can you experience? So, pain behind the eyeball is one of them. What other types of pain?
It can be behind the head. So
Right.
a lot of them come and say there is a pain behind my head, a pain on the top of my head, which is the vertex, and then a pain on the side.
Right.
A pain behind my ear, and it's more like a squeezing, crushing, pounding. Sometimes my eyes goes red. Sometimes I get watering on my eye. When I get the headache, only one side of my eye sometimes get red, and sometimes my nose become runny.
Oh.
I mean, that's when neurologists have to look into the problem. Is it really migraine? There's another type of headache which is called cluster migraine, which I'm not going to complicate things today.
Okay.
But there's another type of headache called cluster migraine, which can be quite similar to migraine, cluster headache, which is quite similar to migraine as well.
Right.
So there are other more serious symptoms that you can have with migraine.
Okay. Wow. All right.
Yeah. I don't know, Niroshah, what sort of pain you had then?
Yeah. What kind of pain, Nirosha? I'm actually very
I
curious.
had like a throbbing pain, like what Dr. Sharini has shared, in the back of my head,
Yeah.
all the way to my temple area.
Uh-huh.
And then the pain just slowly started settling down to my neck and all the way to my shoulder.
Yeah.
So sometimes you just feel like you are feeling a little paralyzed at the top because it's so painful that you're not able to do anything. All you want to do is just sit in a spot or just sleep. That's all.
Right.
I think
So
that's
it's
a very
excruciating pain all the way in your head, this area.
That's a very good point. I just want to say about screen time and looking at a computer,
Mhm.
because we all will have neck pain after sitting in front of the computer for so long, right? A lot of
Yeah.
migraine patients going to say they start in the head and then it's going to go down in their neck and to their shoulders, and as if you feel like someone can just hold your head for you or support your head for you, and it's like rubbing kind of headaches. But then when you're sitting in front of a computer, your neck becomes quite stiff and sometimes it goes into spasm. And this can also trigger the nerves, which then further causes the migraine type of headache as well.
Right. Okay. So in other words, don't just think that migraine is having a headache and one side of the head lah.
Yes.
Yeah, because that's what everybody. I mean, okay, I'm not gonna say that everybody thinks that. That's what I think it is. Like, you have one side, the left side brain, right side brain. Yeah, my right side pain, migraine. So it's not that lah. It's not just that lah, right?
Yeah.
Okay. Okay. Cool. I think thank you so much, for the, Dr. Sharini and also Nirosha for actually joining us on the show today, because I've obviously learned something new, and if you've actually learned something new, if you made it this far to the show, and don't try and diagnose yourself based on this podcast right now, okay? If you are really that's how some people are, they tend to always diagnose themselves. Okay, I'm listening, okay, back pain here, there. If there's something not quite right with how you're feeling, it's always good to consult a doctor, a specialist, okay? If you have a headache, a neurologist. If you have something else, maybe some other specialist. Don't always turn to Google, because I don't think Google... Have you ever turned to Google, Nirosha? Have you ever? Don't lie.
I did. It actually made it even worse for me because I was self-diagnosing, and I was like, nope, this is not the way.
Exactly. So don't be an expert. Don't go Google the remedies. Don't go and say do what, eat what, boil what. But please consult your doctor. Ladies, it's been an absolute pleasure having a conversation with the both of you. I just want to say thank you very much, Nirosha. I'm glad that you're feeling better. And of course, all the best in whatever you're doing. And Dr. Sharini, thank you so much for shedding light on migraine. Thank you so much by giving a head thought into the whole situation. And hopefully our audiences today will be able to take away something from this conversation. Thank you so much for listening, guys. Remember, you can stream us on Spotify and also on Apple Podcasts. Thank you, ladies. We will speak to you guys next time.
Thank you.